Good girl. Okay, slow down, baby. Okay, look at her. Okay, slow down now. I want her to... Okay. Okay. All right, baby. Okay, take a little more. Good girl. Okay. All right, baby. Oh, this poor thing. What has happened to you? Oh my gosh. Hi, everybody. If you can just let us know if we're clear, that would be fantastic. Oh, thank you. It looks like we're clear. I'm looking at the... I'm hoping we have a connection. Hold on. Trying to see if people are... I want to make sure people can see. Come here, baby. Okay, it's coming. Okay, it looks like it's connected now. Excellent. I'm just going to let a couple more people hop on. Okay, baby. All right, baby. Hi. It's okay, sweetheart. This is Zoe, and I'm here with Colleen. And this is, we have named her Sassy. Hi, baby. Hi, baby. Okay. So I'm going to try and talk, and I'll explain what's going on here. We got a private message from somebody down in Miami who found a dog on the side of the road and who was very hot, really was very lethargic, and she was really concerned. She brought her home and the dog was peeing blood. Here, baby. Here, baby. You want a little more? No? Good girl. So she brought the dog home and the dog was peeing blood, and she has a dog of her own, and she was very concerned, and she reached out to us. And so Amy said, go get the dog. We will definitely, let's find out what's going on. The person that reached out, she didn't have a car to bring her to us. She was very grateful to, we're very grateful to her for picking her up and bringing her to safety. And she had asked if we were able to come get her. So Amy said, go ahead, please go get the dog. So Colleen and I jumped in the car. We went and picked her up. We brought her to the rescue house first because they could see us at the vet. They were able to make an appointment at 5 o'clock, and it was like 4:15 when we got to the rescue house. So we took her there, and she looked like, from the outside, the cutest little nugget. She's a little Yorkie. She's chunky. She looked like, oh, this is somebody's dog. We scanned the microchip. There was a microchip. We called the microchip company, and they reached out with the phone number they had on file, and we have heard no response. And now that we have, so Colleen and I took her to Imperial Point Animal Hospital, and they ran a bunch of tests because we knew there was something going on with her ears, something going on with her eyes. And she was not doing this at the time. She was not making these noises, but we knew that there was a problem, and she was peeing blood. So we brought her to Imperial Point Animal Hospital, and the doctor called us because we have to stay in the car, and they bring the dog inside and they do an evaluation. So the doctor called and he says, she is an absolute hot mess. This sweet girl has been, he said, it's sheer neglect. She has not been cared for at all whatsoever. And with that being said, I'm going to go down the list of everything that he found wrong with her, which is strictly from neglect. So if you look at her and she's breathing like this, she has a collapsed trachea. However, what happens is when she gets all worked up, because they were poking and prodding and she was all worked up, they were trying to trim her nails that were curled under. They were trying to look at her eyes because she has a double eye infection. When they were doing this, she gets all worked up and she actually turns blue because she can't get enough oxygen into her body. So when she's doing this and making this noise, it's as though the only way that we could describe it is it's like you're trying to run a marathon and you're breathing through a straw. So this poor girl, she has so much inflammation, which is exacerbated, that she has the collapsed trachea, but then she has all these other issues going on. And the inflammation is so bad that she is gasping for air is basically what's happening. So we're trying to keep her calm. Colleen is petting her and keeping her as calm as possible as we're sitting here in the car. We got her some water because we didn't want her, to be thirsty. And she seems to be calming down a bit now. But she has such an unbelievable amount of issues that are going on right here. So she has a double eye infection. She has a horrific urinary tract infection, and she has blood clots coming out from that. She has a thickened mucous membrane, and that is why she is peeing blood. Her ears are so badly infected that he can't even get the scope into her ears because the inflammation they're almost completely closed up. The only thing he could get in there was Harley could get a Q-tip because he had to run a culture to find out what's going on with her ears. He can't even, there is some medication, there is antibiotic that you can put in the ears that lasts for 10 days. So I said, can you use that antibiotic? He says, I would love to use the antibiotic, but I can't even get into the ear because there's so much inflammation that I can't get into the ear to put the antibiotic into the ear. Oh, she's calming down now. So with that being said, good girl. We'll get her some more water. So you can see that once she's calming down, the breathing is better because she wasn't doing this until she got all worked up. However, you can see her tongue is turning blue. So we're trying to just keep her, this is her gasping for air. So we're just trying to, and then it goes from blue and then it gets more pink. So that's why we're not doing anything right now. We're just petting her and keeping her calm because she's trying to gasp for air. We have named her Sassy because she is sassy. She does not like to get messed with, but as you can see now, she's a really sweet girl. Going back into all the things that she's got going on, besides the double ear infection, the horrific urinary tract infection, and the double ear infection to the point that they can't even put antibiotics in, she has a skin infection, so we're treating that. She has parasites, so we're treating that. So with that being said, we're begging for Sassy. This girl, everything happens for a reason, and thank goodness this girl came into our rescue because we are going to do everything that we can to fix everything that is wrong with her. If she was on the street another day, she would probably not be here tomorrow. They estimate she's and he said it's really hard to tell, but they estimate approximately 7, maybe 8 years old. He said it's so hard to tell because she has so many things going on right now. Hi, sweet girl. I know she's so sweet. So with that being said, they ran a cytology on her ears, urine tests, skin scrapes, the eye tear production, eye tests, blood work, It has been nonstop. They trimmed her nails that were so overgrown. It was horrific. And Amy posted those, I believe, in an earlier post. So, with that being said, because they cannot get the eardrops, the medication into the ears, before we can do that, they have to get the swelling down. In order to get the swelling down, they're putting her on steroids. She is on a tapered steroid dose for 7 weeks to get the swelling down. They are hoping she comes back, and they want to see her in 10 days to see how the swelling is going down. But they can't even treat the inner ear infection until the swelling goes down. And the swelling can't go down until she gets these steroids into her system. So they put her on a dewormer. They put her on antibiotics. They put her on steroids to try and fix these issues. So it's going to have to come in stages. So before we could fix the ear, the inner ear, we have to fix the outer ear. We have to fix the swelling so that they can get the medicine in there. You want more water, baby?
Yeah, I tried.
Okay. You want more? Oh, now you want more? So we are actually sitting in the parking lot at the rescue house because we want her to calm down. We want her to get her oxygen in, to be able to breathe normally, and just to come out of being so worked up from being worked on in the animal hospital. Because when we got her at first, she was breathing okay. But he said because of the collapsed trachea and because of everything going on, that is why and the collapsed trachea is very common in this breed, but hers is extreme. So, and plus he's hoping that the steroids will help with the collapsed trachea, will help the swelling as well, so she can take more air in. So with that being said, for anybody who is just hopping on, this is Sassy. I am in the car with Colleen. This is Zoe. We picked up Sassy from someone in Miami who found her on the side of the road. She is so sweet. She has a lot going on. She has a double ear infection, a horrific urinary tract infection, and she's peeing blood. She has a skin infection. Her nails were curled under and they trimmed her nails. She has parasites and a double ear infection. We are begging for donations. Please, our PayPal link, if it should be on this post, any amount helps, whether it's $5, $2, $20, it all adds up because this little girl needs us. She was found on the side of the road. Thank goodness she was found, and thank goodness she is with our rescue because it is hot. It was 98 degrees today. She didn't even know which way she was going. So we don't know how long she's been out there. We don't know what her past is, but we do know for a fact that she was neglected for the time that her owner had her. Nothing has been done for this girl. So we are begging, please, make a donation. Good girl. Please make a donation for Sassy. She's a little Yorkie. She is 7 pounds. I'm sorry, was it 7 or 9? She is 9 pounds and she's overweight. So she needs to lose weight. And that is going to help with her healing as well. So she will be on a strict diet with us. But he said that is not helping the situation. So she was probably eating all kinds of food that she wasn't supposed to have. And yes, Anna Maria, most of this can be fixed by the doctors. The urinary tract infection, the double eye infection, the double ear infection, the parasites. She's on dewormer as well. We have eye drops for her. That can all be fixed. As far as the collapsed trachea, he's hoping that the steroids are going to help with that because it's extreme. But I can tell you that when we picked her up originally, her oxygen intake was great. I shouldn't say that. Her oxygen intake was fine to the point where she wasn't gasping for air. So now we're waiting for her. We're not going to leave her until we know that everything is calm. We're going to sit with her. We're going to make sure everything is 100%. She's going to go to the rescue house, and Amy will be there. And we're going to bring her over and sit with her because we want her to calm down. But we are begging, please, please donate for Sassy. And we will keep you posted on how she's doing. I'm looking at the comments here, Karen. Why did the vet let her go? I don't know what you mean. I'm a little confused. Yes, we are not going to just leave her. She will be watched. She will be cared for. We're not, the vet would not let her go if there was an issue that was not something that we could watch over. So we will absolutely be watching over her. Thank you so much, Donna, for your donation. Thank you to anybody who has donated towards her care. Yes, that is her that is her noise. That is her trying to get enough oxygen in. And then we'll notice she'll turn blue and then it'll turn pink again. Once she calms down, she'll be good. And like I said, hopefully the steroids are going to help that inflammation as well. So please donate for Sassy. This is Zoe and Colleen with 100 plus abandoned dogs of Everglades, Florida with Sassy. Say thank you to all. Look at her. She's so sweet. She just, hi, say I'm giving kisses. I'm giving kisses. So she's very, very sweet. Yes, so we're going to bring her to the rescue house, and she's going to de-stress. She's going to relax, and then she'll be good. Her breathing will settle down because before we brought her in, she was not like this. So it's all just from being worked on in the vet. So now she's starting to calm down. She's much, much, much better than she was when they first brought her out. And she's hopefully only going to get better from here. So thank you to all of our supporters for your love and your donations. And everybody, we will keep you posted on how she's doing. This is Zoe with Colleen with 100 plus abandoned dogs of Everglades, Florida with Sassy. Our donate link is on the page, Tammy. Thank you so very much.